Hey, Dr. McNamara here, and today I wanted to talk about one of the most common culprits of low back pain that I see in my office, and that is sacroiliac or SI joint pain. Now, the sacroiliac joint is a very unique joint, and it is created up of the sacrum as well as the ilium, and with the addition of the ischium and the pubis, that creates our whole pelvis. But the main bones we're focused on in this video is that sacrum and that ilium. So with the sacroiliac joint, a lot of people used to think that it didn't have any movement. It was an immobilized joint, a syndesmosis joint. That's not actually true. In fact, research has shown that the sacroiliac joint has on average about 2 to 4 millimeters of translation and then about 2 to 4 degrees of rotation as well. And that can vary between individual to individual. Another unique thing about the SI joint is that it can be very different from individual to individual. And with that said, it can even be different between sides on the single individual. What do I mean by that? So the sacroiliac joint is a synovial joint, meaning that it has a capsule and then there's synovial fluid that allows for ease of movement during movements of this joint. In certain individuals, they may have capsules on both sides or maybe even one. And MRI studies have shown that even within the same individual, they may not even have the same sacroiliac joints bilaterally. So what causes SI joint pain? Well, generally what we see is it starts with a lack of movement or too much movement, and then that creates inflammation either outside the joint of the other structures and tissues around the joint or within the joint itself. The good news that whether it's too mobile or not mobile enough, the intervention is very similar. So the first thing we want to do is make sure that we have strong stabilizers within the area. The major muscles when it comes to stabilizing the lumbopelvic area, which is the area of focus that we're talking about today, is going to be our abdominals, primarily the transverse abdominis. It's going to be the gluteal tissue, as well as the QLs and the erector spinae muscles that go up and down our spine. We're going to start with talking about how to brace our abdomen with an exercise that I like to do that works the transverse abdominal muscles. And essentially what the name of this exercise is just an eccentric transverse abdominis contraction. So the way we practice this movement is we're going to be pushing outward on our stomach. So we're kind of making our belly appear bigger. Start with 2 little L's, put them about belly button height, and then you're going to push in. From there, you just want to see if your fingers can move by pushing them out with your belly, and that's a good contraction there. It's nice and hard. We then want to go to the anterior superior iliac spines, the ASIS for short. Go just inside of that and do the same thing, push in a little bit, and then make your fingers move through transverse abdominis contraction. There, the last place we want to go to is those little dimples on our back. Those are the posterior superior iliac spine, PSIS for short. And for those, you're just going to put your muscles on kind of those erectors on the inside of those dimples, and you're doing the same thing. You want to make your fingers move. And I'll perform one just with my shirt out so you can maybe see the actual muscular movement. So I'm relaxed and I'm going to contract. Get one more. Okay. The next major stabilizers that we need to work are going to be in that hip, and it's going to consist of the gluteal muscles, the glute maximus as well as the glute medius. If you're suffering from SI joint pain, I recommend starting with a bilateral movement, and we'll progress to more unilateral movements that we'll do later in this video. First exercise we want to do though is simple. It's just going to be a glute bridge. So to begin this exercise, you want to stabilize your low back by kind of pressing it into the ground and putting your pelvis in a good position. From there, you want your feet about hip width apart at the same distance, and then what you're going to do is you're going to contract. First, you're going to contract your abdomen, make sure that's nice and braced, and then you're going to squeeze through the glutes to start working the glutes. You should feel a nice contraction of the glute maximus during this exercise. As you start to get better at that movement, we can then start performing unilateral gluteal movements, such as a hip abduction circuit that I'll show you here. So this is to isolate one side at a time. So if you have a weaker side, this could be more beneficial to do on your weaker side a little bit more. So for this exercise, what you want to do is perform abduction of the hip. And to do that, first we're going to find the glute medius, which is going to be first find your greater trochanter. It's that bumpy part on the outside of the hip. Then you're going to go back about an inch and then up about an inch or so. And it is probably tender if you're suffering any type of symptoms. From there, you can kind of massage the area. And as you do it, we're going to abduct the hip and just go down, just tapping the feet together. Do about 10 of these for the circuit. And then the next, what we're going to do is we're going to turn the toes inward and we're going to tap our toes. Once we strengthen that range of motion, we then want to tap our heels by putting our toes up and tapping our heels together. And then again, repeat for about 10 repetitions and repeat this about 2 to 3 times each side. Now that we've gotten a little bit more strength and stability in our gluteal tissues and our transverse abdominis, I then want you to start performing these stair step downs for the glute medius. Now for this exercise, what I really want you to focus on is abduction of the hip. And the way we're going to do that is you're going to make sure your knee is not falling inward or caving in. You want to actively push it laterally. So as I'm doing this exercise, I'm going to kind of point my toe up on the contralateral leg, and then I'm going to focus on tapping my heel down with making sure this knee stays going to the outside. So it's staying above my ankle joint, or outside of it, it's not going inward. So we're really activating that glute medius muscle. As that movement gets more stable, we're then going to want to perform single leg exercises that cause flexion and extension of the spine and the SI joint. One of my favorites for these is a single leg RDL. For this exercise, what you're going to do is you're going to start on one leg and then stabilize the core, and then focus on performing the RDL type of movement, staying controlled throughout the entire time. And then as this gets easier, feels pretty stable, what you can do to make it a little bit more difficult is grab a weight, and then holding the weight in one arm is going to make it a little bit more difficult because we're offset, so we have to use a little bit more core stabilizers. And you're going to do the same thing. Just focus on that RDL movement, working on balance and that flexion extension type of movement as we stabilize. Now, these are a couple stretches that will help with that SI joint type of pain, but it's imperative to make sure that you do have the proper strength and that the joint is stable before doing any type of these exercises for more of that relief of the pain. So first things first, make sure you got that strength and stability. Then we can work on a little bit more flexibility as well. One of my favorite ones for this is just going to be a simple low back twist. And you may hear snap, crackle, pop while you do this. And then for beginners, just hold for about 30 seconds or so. And then for more advanced individuals, you can perform rails type of movements in which you're focusing on reciprocal inhibition, contracting away from the stretch, and using that movement to distract the brain so you can actually get deeper into the stretch actively and passively. I'll link to another video that explains this exercise a little bit more in detail. Another great exercise that will help relieve particularly that gluteal type of pain that's associated with the SI joint is just taking your knees into chest and just holding and relaxing. If one side's worse than the other, you can bring that knee across the body, and that feels really nice in that upper gluteal area. So if you or anybody you know is suffering from any type of low back or SI joint dysfunction or pain, have them check out this video, practice these movements, and see if that helps. I hope this information was beneficial for you, and if you like this type of information, please like and subscribe for more. Thank you.